Episode 10 of my podcast. I'm Dr. Zero Amelia, physician, firefighter, writer. I've been on YouTube since 2009. You can check out my channel and find out my many adventures. And if you like my content and you can find it in your heart to subscribe, click below. And a little update though. I have deleted about 100 of my previous videos because I was forced to. YouTube has been changing the guidelines, and after 10 years of being with YouTube, I can say that it is entirely different now than it was when I started vlogging and posting videos. One of the videos I'm very well known for is the rabies educational video that I uploaded 2011. I don't own the video, but I was able to remaster the video and translate the language to English. I was able to supply the world with info on how scary a disease like rabies is. But after 890,000 views, it is now gone forever from YouTube. Today, I'm going to be sharing with you my thoughts on a similar disease that has been crippling the world prior to COVID. It's tuberculosis. It's a disease that kills 1.5 million people every year globally since 2013. As I'm recording this, it is June 17, 2020. COVID has already claimed the lives of 400,000 individuals in its 7 months of existence. It has surpassed tuberculosis in the number of lives dead per day and the number of infected per day. The numbers could even be larger because not everyone has the benefit of mass testing. COVID is a droplet disease, while tuberculosis is an airborne disease. While tuberculosis is far more efficient in infecting human beings, COVID's virulence is higher because it's new. There is no medicine for it, and there is no vaccine for it. The world has called on for measures to fight this disease that is unprecedented, but is the only thing we can do right now. I've been in the front line since January. I've been handling suspect cases in the community, and it was no easy task. It had to take a couple months more and the state to strengthen the measures of strict home isolation, wearing of face masks, and self-reporting of symptoms to take place. When quarantine was imposed, I saw how the public health system had to break down and prioritize COVID response. I heard how the experts said that due to the lack of response to other health problems, we could see a resurgence in the cases of other diseases like measles, polio, influenza, and most of all, tuberculosis. However, with what I'm seeing in my community, I noticed that it was the reverse. The greatest impact was on tuberculosis. Was it because of a low case detection rate, or was it because something else changed in my people's behavior? Strict home isolation orders during lockdown limited patient movement. The stigma of coughing was worse than I've ever seen before. I was able to go to patients' houses that were suspected of COVID only to learn that they were suffering from tuberculosis. But somehow the stigma worked because relatives were wearing face masks and keeping their distances away from those patients for fear of COVID. Just like COVID, tuberculosis needed a fresh, new host to thrive. If patients were isolated in their rooms, the risk of the community from getting an airborne disease like TB is brought down to near zero. Then there was the quarantine pass. The quarantine passes were only given to persons above 21 and below 60. Since tuberculosis, even among the marginalized, tend to affect more the extreme of ages, tuberculosis transmission was again effectively stopped. The enhanced community quarantine extensions have further hindered the mobility of patients who may have tuberculosis. The masks, whether cloth or medical grade, seem to work to stop the further spread of the disease. Even with cloth masks, coughing up diseased sputum is very hard. tuberculosis is not effectively aerosolized even with substandard masks. The transmission of tuberculosis is effectively hindered with such measures alone. The quarantine measures seems to be helping to bring back the health of the community, and never have I seen constituents leaning more on the preventive side of handling infectious diseases. Everybody now is spraying alcohol on their hands and using sanitizers and phenol products on surfaces. The ambience we have today is truly remarkable. The transmission of polio in the Philippines has temporarily stopped. Measles, another airborne virus, and much stronger than COVID, has yet to show resurgence. And the influenza virus is being fought by people buying into vaccination than ever before. Then, when I asked our city's tuberculosis program coordinator, he only confirmed what I have been speculating all the time. The number of TB cases has dropped tremendously. That the data in the Philippines today is comparable to the data analyzed 8 years prior. With 10 years of trying to deliver the benefits of following the basic public health measures, I am only seeing it followed today because of COVID. The end of TB might just be around the corner because of it. Hopefully, after a year or two from now, I hope that the people will still be aware and health conscious post-COVID. But I guess it's alright to hope. Well, that's it for today. If you like this video, give it a thumbs up and share it. Again, if you like my content, check out my channel to do so, subscribe and ring that bell for notifications. As always, this is Zero MD. Peace out.